Hello everyone. Today we are going to look into generalized anxiety disorder. So this video is going to purely revolve around the clinical picture of generalized anxiety disorder. So before we get into understanding the clinical picture, I want you to quickly understand and relate to this disorder. So, all of us tend to be anxious at some point of our time, say before an exam or before something that's really important to us, like an interview or a viva. So, there are situations where all of us tend to be anxious, even say during a flood or natural disaster. So, we tend to be anxious. So, anxiety is a common emotion. So it's not that anyone who is experiencing a sphere of anxiety means that they have a problem. So you need to understand and get that right first. So anxiety is a common symptom. That's one thing that you need to know. It's a common emotion. So when we are looking at anxiety, it also has its own way of adaptiveness. Okay, so it has an adaptive value to it. So for example, if you're not really anxious about how you're going to do your interview really well, you will not really prepare for it. Or if you're not really going to be worried about how are you going to manage your finances, you're not going to really prioritize on what to spend on and how to save. So anxiety in itself is not wrong or is not a disorder as such. Okay, it is an emotion that has its own adaptive value. So all of this works well as long as anxiety is in moderation. Okay, so the only issue happens when anxiety gets a little severe and it's chronic. So when it's a little severe and chronic and across different life events, then you call for a diagnosis of something called as generalized anxiety disorder. So when we're looking at generalized anxiety disorder, let's quickly look at the clinical picture. So there is anxiety which is very chronic, excessive, and unreasonable across many spheres. This can be like revolving around finances, it can revolve around family, work, anything. So it can have any kind of sphere. It can even include personal illness. So there are many issues surrounding which this particular anxiousness can revolve on. So you need to know that the DSM-5 TR has a lot of classification in terms of how to diagnose this particular disorder. So when we are looking at the diagnostic criteria, which is right here as a picture, you can notice the criterion A kind of summarizes beautifully of the fact that anxiety and worry is supposed to be present for a lot of days for at least 6 months. So this is one of the chief symptom of generalized anxiety disorder, and you need to know that this anxiety or worry is very difficult to control. Like even if you consciously think that I want to control it, it really doesn't happen. So that is A and B. Criterion C talks about other symptoms that needs to be present to qualify for the diagnosis. So like you can see, there are 6 other symptoms, of which you need to know that you're supposed to have a minimum of 3 symptoms. So minimum of 3 symptoms for at least about 6 months. So when there is 3 or more symptoms of the criterion C, okay, then also it's like a double clarity of the diagnosis. You need to understand that generalized anxiety disorder also causes impairment in social, occupational, and other areas of functioning. So, this is criterion D, and you need to know, of course, that it is not because of some other substance or medication, or it is not you cannot attribute this anxiety to another anxiety disorder or another physical condition or any other disorder per se. So that is with regards to the diagnostic criteria when we're looking at anxiety disorder. So when we're looking at people with anxiety disorder, you will often notice that they are always in a future oriented mood state, like what's going to happen next, or what if this happens, what if that happens. So they're always on the future oriented state with a lot of anxious apprehension, like okay, the worst things are going to happen around me. So, and they are also very very hyper vigilant about certain signs which could signify something that is threatful. Okay, so like a danger symbol, or someone with a starry face, or something that is anxiety provoking, which most of us would avoid, would be something that is like constantly ringing on their mind. All right, so they are always in the future oriented state, and they are always in the anxious apprehension mode. So this phase of anxious apprehension is one of the chief criteria for generalized anxiety disorder. Another thing that you need to know about people with generalized anxiety disorder is that they find it very very difficult to make decisions. So even if they do manage to make a decision, they kind of keep wondering whether this is going to work, or what are the worst things that can happen if it doesn't work. So they find it really really hard. So the sad thing here is they are not able to be in the here and now present, and they fail to enjoy the reality of the present moment, which causes them to really be in a very anxious state constantly. So that's about the clinical picture of generalized anxiety disorder. Let's quickly look into the onset and gender differences. So we need to know that generalized anxiety disorder is much more common in women over men. The age of onset is very hard to determine. However, research points out of its occurrence most commonly in the older adults. You need to know that generalized anxiety disorder is a very, very chronic condition, okay, which kind of stays with a person throughout. So that's why it's really hard to actually determine what's exactly the age of onset. So when we're looking at comorbidity, that is the other disorders that could commonly occur with generalized anxiety disorder, mostly other anxiety and mood disorders are few disorders that kind of commonly co-occur with generalized anxiety disorder. So they include panic disorder, social anxiety disorder, specific phobia, PTSD, and major depressive disorder. And you need to know that sometimes people with generalized anxiety disorder may also have occasional panic attacks, which kind of comes and goes. But you need to know that they are not really worried about having another panic attack, which qualifies for a panic disorder. So panic attacks may happen without the qualification of actually having a panic disorder per se. So that is another thing that you need to know with regards to comorbidity. So with this, we come to an end of this particular video, which talks about the clinical picture of generalized anxiety disorder. I hope you have all understood the clinical picture in terms of the current DSM-5 TR. Thank you.